strategy that's succeeding. We do have a military whose morale is up because they see this success. This has consequences far beyond Iraq, throughout the entire region. Look at the behavior of the Iranians, the Syrians, the uneasiness of our so-called allies in the region. This is a historic moment in history. And I am going to be judged by history, not by public opinion polls. And I believe that we can and must prevail, and we've got the strategy and the general that can do it. Give us some time for it to succeed.
I want to move on now to domestic issues. Healthcare, one of the #1 domestic issues we heard about in our poll. You hear about it every day out on the campaign trail. This week, the Senate debated whether or not to expand health insurance to children in the United States. And for this, I want to turn to the question of David Yepsen.
Governor Huckabee, Senator Grassley helped fashion a compromise plan to cover 3.2 million more children by raising the cigarette tax. Poor children. President Bush has threatened to veto. Who do you side with, President Bush or Senator Grassley?
I think I'd like to side with the people of America who really are looking for a lot better action than they're getting out of the President or Congress. And you know what? If you want to know how to fix it, I got a solution. Either give every American the same kind of health care that Congress has, or make Congress have the same kind of health care that every American has. They'll get it fixed. And the issue in this country is that we really have an incredible problem because our system is upside down. It focuses on intervention at the catastrophic level of disease rather than really focusing on prevention. So we've got a system that no matter how much money we pour into it, we're not going to fix it. We're not going to fix it until we begin to address the fact that this country has put its focus not on wellness, not on prevention, not on health, but on sickness. And that's the single most important and urgent thing that has to be done. And if we don't do that, then we're going to continue just pouring money, and it's almost like having a boat that's taking on water, and rather than plugging the hole, we want to get a bigger bucket to take the water out of the boat.
Governor Thompson, same question to you. Who do you side with in that dispute, the president or Iowa's senior senator?
David, I want you to know that health care is one of my major dominant fields. I was Secretary of Health. Neither one of them are right. The problem is Governor Huckabee is absolutely correct. We've got a sickness, illness, and disease society. We spend 90% of $2 trillion, ladies and gentlemen. That's 16% of the gross national product on getting people well after they get sick. Less than 10% of the money keeping you out of the hospital, out of the nursing home. Does anybody in America think that's a smart idea? I think it's dumb. Let's go to wellness and prevention. Let's #2, let's start managing diseases in America. Let's make sure that individuals that are chronically ill and physically disabled are able to get the quality of health and therefore get the quality of life. They take up 66% of the cost. You could reduce that down to 50%.
Congressman Tancredo.
#3, I just would like to say, on the uninsured, you could get one form, like we do in the 1040 for taxes, one form for the employment system, and you could save $137 billion. That will cover all of the uninsured in America without raising taxes, ladies and gentlemen.
Congressman Tancredo, how do you cover them?
Yeah, listen, let me suggest we think about something in the area of health care that perhaps is unique, different, and scary to some people, but that is this. The government, it's not the responsibility of the federal government to provide womb-to-tomb health care for America. Okay? And so we constantly debate on exactly what way we want to push government control of this issue, but in every way we're doing it, it's unhealthy. It is unhealthy to have a government health care plan in America. There are some things we can do, absolutely. The expansion of health savings accounts, that increases individual responsibility. The allowing for people to actually take the reimportation of prescription drugs. And not only that, but let's do something about the 12 to 20 million illegal aliens in this country that are taking a large part of our health care dollars.
Thank you. Gentlemen, I want to give this back to David Yepsen in a second, but I just want to clear something up first. Congressman Tancredo, I know you voted against the expansion of the children's health insurance this week. And this is just yes or no, Governor Thompson. Are you for the expansion or with President Bush on the veto?
I am for expanding SCHIP, but not the way Congress has done it.
Okay, so that's a no. And the same thing for you, Governor Huckabee.
The problem with it, it actually would bring cuts to the Medicare alternative, which is the worst thing we could do because it then takes money away from seniors.
Now, I also,
again, it's just not a good solution.
Now,
it's
I also know that
congressional solution.
Congressman Paulin, Congressman Hunter, and Senator Brownback and Senator McCain, you all voted against the expansion as well. So the only two gentlemen left here are Governor Romney and Mayor Giuliani. Are either one of you for the expansion of children's health insurance as outlined by Senator Grassley?
Look, it's critical to insure more people in this country. It doesn't make sense to have 45 million people without insurance. It's not good for them because they don't get good preventative care and disease management, just as these folks have spoken about. But it's not good for the rest of the citizens either, because if people aren't insured, they go to the emergency room for their care when they get very sick. That's expensive. They don't have any insurance to cover it, so guess who pays? Everybody else. So it's not good for the people that aren't insured. It's not good for everybody else.
So you're against it as well.
No, let me finish. Green light's on.
Okay.
We have to get, they just turned it off. Leave it on.
I control it. It's okay.
Right, that's it. We have to have our citizens insured, and we're not going to do that by tax exemptions because the poor, the people that don't have insurance aren't paying taxes. What you have to do is what we did in Massachusetts. Is it perfect? No. But we say let's rely on personal responsibility, help people buy their own private insurance, get our citizens insured, not with a government takeover, not with new taxes needed, but instead with a free market-based system that gets all of our citizens in the system. No more free riders.
But a no on the Grassley bill.
Mayor
Mayor Giuliani, go ahead.
The bill had two very unfortunate